All right. Good morning, Cochise County, southeastern Arizona. We are out here with P3 and Adobe Health Population. Adobe Population Health. I got it right there. There we go. And we are out here. We are doing a ribbon cutting. We are welcoming them to the community. And if you have a chance, please come out here. We have all kinds of vendors out here. They have goodies out here. But we're going to tell you a little bit about exactly what this is and why you should be out here. So, but first, before we get to that, we want to say thank you to Carolyn Humphrey, our Mayor Pro Tem, is here. We also have Fiona DeYoung from Congressman Scamani's office waving in the back. But a few words from Carolyn.
Thank you, Melanie. We did make it here eventually. We went on Torre Vista first. Just a little hiccup, but we learned to pivot, right? And we made it. And I saw the balloons and how you all set up. It looks so nice out here. And I was like, if this is the place, whether or not we are doing the ribbon cutting here, because it's gorgeous. We're so happy to see Adobe Population Health enter our community, the first one in the state. I understand to set up a actual brick and mortar or go into a place like this. So excited to have another resource for our residents and the surrounding area. And another community partner to work with our the hospital, Chiricahua, Patel, all the doctors and providers in the area. So if you're looking for a place to get more education as a senior citizen, you can come here. They'll also be offering screenings. I've been fascinated. I can't wait to see inside. But welcome to the community. And if there's any way we can help you, just know that we're only a phone call or an email away. Thank you.
Thank you, Carolyn. And next up, we have Dr. Rana speaking from P3.
Thank you, everyone. It's an incredible pleasure, to be here. And to Carolyn's point, the things that, we can provide to this community, through this resource center. So I am Dr. Rana. I'm a family physician by training, in practice, work for P3 Health Partners, along with Davey Arger, who's our market president. And I've been very fortunate as a practicing physician to lead through the journey of a patient in really impacting their health outcomes through practicing evidence-based medicine, through making sure that the care navigation is as smooth as it can be and the care experience is improved. Having said that, it's very important for us to really think through two real conundrums, if you may, or opportunities. One of them being, what can we do for value creation? And this step today is the right step in making sure that the care is, in fact, health care or well care and not sick care, right? And that is really important for us to know, because there is only so much I can do through my clinic, through my practice of medicine. Then there is the communities that need to come together. So the second piece to the value creation is patient and community engagement. Health begins at home, and we all, for which I really thank you for coming here today in attendance. We all need to be the ones who need to speak to influencing why preventive care is important, why care through a community mindset is important, because that's what's really going to get us to where we need to be. So again, this is where I really am very passionate to work for P3, and the P3's value proposition is just that. Our vision is to make sure that we create value for all that we serve. The thousands of members we serve here in Cochise, but about 54,000 members we serve across the state of Arizona. And to partner with partners like Adobe, partners like WellCare, that just makes you feel so much better as a physician. As a clinician, I could probably influence 2,000 members who might be my patient panel. But when I partner with the groups like this and the communities, thousands and thousands, right? So once again, I want to keep it short, but thank you all for coming here, and I'm very excited. Please spread the word so that the resource center is in fact used to its full capacity. Thank you.
And next up, we have Mike Franks with WellCare.
Hi, thank you very much for having us, and this has been a wonderful partnership. So I am with WellCare, but we have a lot of names, and I'm just going to go through a quick little journey here. So WellCare is now our Medicare Advantage plan. We are a part of Arizona Complete Health. Arizona Complete Health is the largest Medicaid provider across the state of Arizona. We have been in Cochise County since 2005 with our Simpatico brand name. There you go. See, where you go. All right. Simpatico brand name. Also, we've been here since 2015 with our Medicare Advantage plans through HealthNet. Okay. I can double check this out here. Also, we've had Bridgeway products that have been in the area at some point in time. And then in 2018 came in with our Arizona Complete Health Complete Care plan and have the acute care population. So it's been a journey. And one thing that we have not done is leave. And I just want to make sure that everybody understands that, because that's something that we think is very, very important. We have statewide coverage with our Medicaid and our Medicare Advantage products. We particularly look at our DSNP plans, so our duals that have both Medicare and Medicaid coverage. And turn back the dial about 5, 6 years ago, 7 years ago, we were trying to figure out a way to make things work in Cochise County, because this is a unique community. And the way that we look at it from Centene, which is our parent company, another name brand, and Arizona Complete Health, is we improve the health of our communities one person at a time. And you can't do that through these large efforts that are on a telephone or are not really engaging with our members one person at a time. So we became close partners with Jamie and Adobe Health to roll out something specific to our plan. And I want to let Jamie talk a lot more about that model. But it allowed us to get our financials in the right spot and not leave. All of our competitors have left. We never left. We wrote it out, and we're here today, and we continue to invest in things like this, work with P3, and then continue to try to serve this population. So, Jamie, can I hit it, Jamie? Can I hit it, Jamie? Tell me about yourself.
So, as Mike said, Adobe has been in Cochise County for 7 years. And I'll tell you a little bit about how we got here. Basically, Mike said, if you can go down there and you can make a difference, you can keep your contract. If you can't make a difference, well, it was a good try. So here we are 7 years later. So I think we've made an impact. But I think the most important thing is that what Adobe also is another name. Previously, it was Adobe Care and Wellness, and this year we changed our name to Adobe Population Health, because what we do is really that. We affect the health of a population. And how we do that is based on the thesis that runs our company and has for as long as we've been around. And that is, if we improve the quality of life for an individual, their healthcare costs will go down. And in that very first year that we were here, 7 years ago, we lowered emergency room costs by 70%. Now, how did we do that? Very simply, we made sure that people were getting the care that they needed in their homes, because we send nurses, nurse practitioners, dietitians, social workers into the home. And we give them the education and the tools to make their lives better. And in impacting those ED costs, what we did was we figured out that you don't have to be airlifted to Tucson all the time, right? That was a big step. But at the same time, as we're looking at that, we're also looking at, do you have enough money for food? 12% of the population here in Cochise County that are over 65 tell us they do not have enough money for food. So our social work team, who are standing back there, waves and all of them that are all your team that are here, they are diligently looking to fill that resource. Do you have enough money to pay your utilities? 8% of the population we work with says, no, I do not have enough money to pay my utilities. So we work to get that resource covered. One of my favorite stories, this was a woman, 83 years old, lived here in Sierra Vista. The nurse went in to see her after she'd been hospitalized. And she walked into the home, it was winter. She had little ceramic heaters in every room. And the woman said to her, look, I can't flush my toilet because my septic tank is backed up and I have no heating and cooling. So unless you can fix that, you just go on and get out of my house. That day, that nurse got a company here in Sierra Vista to empty that septic tank so that she could flush her toilet. And by the end of the week, a new heating and cooling unit was put on her roof. And that was out of the generosity of the company because they did it for free as long as they could use her name in their advertisement. And so that's an example of not just what Adobe does, but what the community does, bringing it together. So as Dr. Rana talked about, it's not just healthcare that needs to be involved in how we make people's lives better, because that's what affects healthcare. It's not another pill. It's not another test. It's about how lonely are you? Is there someone that you have that is your neighbor that is alone all the time and would love a conversation or a game of cards? Do you have enough money for food? Can you get to your doctor's appointments? So it's fabulous that we have been blessed to partner only with WellCare in providing these services, and also to have now a partner in P3 so that we can utilize all the resources we have together to make people's lives better. And so this, what we're doing here, we are all so super excited about it, because we now have an opportunity for a place for our social workers to meet with individuals who don't want us to come into their homes, to do educational training on diabetes education and managing your heart disease, to also do mini health fairs here on a monthly basis. And that's what we're looking forward to doing. So thank you, Cochise County, for having us in your homes for the past 7 years. We look forward to another 7 moving forward. And welcome to the center. We'll be sending out a schedule to everyone to what we'll be doing in the new year, but we're super excited about it. So thank you very much.
Okay.
Thank you so much for all those inspiring words. It's so wonderful to know 7 years already, another 7 years, but to be able to make it, to have that goal. If you can make it happen here, right? You can make it happen anywhere, right? But we can do that. We can do that later, not on the mic. But no, it's wonderful. Cochise County, southeastern Arizona. I always think that we're the most generous down here, caring, giving communities, and to be able to make this happen and to see this grow, to provide more services, it makes my heart happy down here. And for all of our folks that are out there watching, we all are always looking for ways that we can give back, ways that we can help out. And so please come down here, check it out. There are ways down here that you can help. There are volunteer opportunities, I'm sure, and just so many other ways that you can support. So please come down here.
I already did.
She already did. That's right. And so, but I want to thank a few other people that are here today. Brandon Jeter from our board of directors. We have Tracy Schilt, and Brandon's with BSI Group. Tracy Schilt from Haven Health, and then we have Betsy Brown over here from Bayada. These are 2 ambassadors with the Chamber of Commerce, and of course our staff are out there as well. There's Samantha and Donna Lori. And so anyway, I want to thank everybody. But before we do the official ribbon cutting, we have a proclamation for you that Betsy's going to read.
Thank you, Melanie. This is the Sierra Vista Chamber of Commerce proclamation. We, the ambassadors, together with Sierra Vista Area Chamber, do hereby proclaim this day of new beginnings. We wish Adobe Population Health continued growth in the San Pedro Valley business community. We present this certificate, which carries with it 100 years of good fortune. Signed this 16th day of November in the year of 2023. Signed Melanie Edwards Barton, Chief Executive Officer, and Jay Williamson, Chairperson of the Board.
All right, so. All right. Together.
Hold that mic.
All right.
Is that man right there? Okay. You ready?
Wait, on the count of 3. Ready, everybody?
One, two, three.